Those of us in the public health world often make the mistake of thinking that science and evidence alone are enough to convince the public and policymakers to follow our advice. How often we are proved wrong. The COVID-19 pandemic has been a powerful demonstration of the need to engage communities, understand their concerns and motivations, and adapt strategies accordingly. Governments have had to persuade their populations to accept new behaviors and conditions, all in the context of rapidly evolving evidence. As part of our transformation, we created a new unit for behavioral sciences to integrate evidence about why people make the decisions they do into our programs and policy work.
That leads me to Professor Mobarak. You are an advisor to the government of Bangladesh, and throughout this pandemic, there's been so much talk about lessons learned from the pandemic. At yesterday's roundtable, Dr. Tedros rightly said that the science should lead behind and politics should follow after the science, which was very well said. What kind of behavioral insights-based guidance, if I can use that phrase, did you actually share with your government, especially during the height of the pandemic?
Sure. Thank you very much. Assalamu alaikum and Bismillahirrahmanirrahim. So what I'll try to do today is, we just heard a lot about the pandemic, so I'm going to change a little bit what I want to talk about. I'm going to try and avoid the pandemic. And the reason is that, the fact that masks, vaccines, it's difficult to change behavior, it's difficult for people to stick with a new behavior, right? That's something that didn't come as a surprise to us. It's something we knew for a long time, because there's lots of other categories of behaviors, of technologies, of products, which we think make people's lives better, that people are really averse to, right? And it's really puzzling. Why is it that they're not taking up things that should make them better off? Are we wrong about it, or do we need to understand, what constraints we have and how do we overcome those constraints, right? So let me try and give you examples from other sectors, right? I'll do some public health, but actually I want to broaden it even further. And what I'll try to do is, I'll just try to tell you some stories. And there is data behind it. There's randomized control trials behind it. I'm not going to bore you with it. I'll just tell you the bottom line stories. Okay? So there's this big puzzle in development economics that for many important classes of development challenges, we have products, technologies, behaviors that the engineers, the doctors who came up with it, the technicians, they really believe in it. It works well in the lab. We take it to the field. We try to get people to adopt. Nothing. Okay? So in public health, examples like acute respiratory infections, the WHO claims is a large share of non-communicable disease burden, right? There's simple technologies, like it's linked to indoor air pollution exposure, which comes from biomass burning, right? There are technologies like improved cook stoves, cleaner burning cook stoves. That's a technology that would work, but I go to rural Bangladesh, and we see the penetration of non-traditional stoves is basically nil, right? In sub-Saharan Africa, malaria remains an important problem. Simple technology, insecticide-treated bed nets. You offer the bed nets at 70, 80% subsidies, right? Take-up is low, okay? Diarrheal disease remains a big problem, okay? Simple technologies can address disease transmission. What is that? A toilet, right? But you have to use it, okay? And until recently, half of all rural Indians weren't, right? And that's a big public health threat. Okay, so now other sectors. So let's think about agricultural technology. So when I was growing up in Bangladesh, right, a big challenge we faced, a big worry, and on TV almost every day, was food insecurity. 100 million people in a tiny country we're struggling to feed. The population projected to increase to 150 million. How on earth will we feed all these people? That happened. It's now at over 150 million. It's not a problem anymore. Why? The Green Revolution happened, okay? So that was about new agricultural technologies, high-yield variety seeds, drought-resistant seeds, along with fertilizer, irrigation, et cetera, right? So why am I telling that story? That's a success. Even though it's a technology, the Green Revolution, that doubled or tripled productivity, right? It still took 30, 40 years for it to take hold. Imagine you had something that would double or triple your income, but you waited years and years and decades to take it up. If we could have sped up that process by 15 years, the welfare consequences of that would have been enormous. So we need to understand why it was slow. Okay? And then other sectors like financial products, livelihoods vary a lot in rural India from one year to the next because of rainfall variation, whether the monsoon arrives on time or not. Okay? 80–90% interannual variability comes from rainfall. Okay? If you or I had a event that affected 80% of our livelihood, we would definitely want to insure against that. Okay? We buy insurance for much smaller things like car accidents, right? But formal insurance markets are largely absent in rural India, right? So these are big puzzles. We need to understand why. So let me now turn to what we do about it and what the lessons are, okay? So what one branch of behavioral science does, as a development economist I do, we run randomized controlled trials, not for efficacy of, say, vaccines, but to figure out by randomly varying the way we encourage people, right? Whether it's through subsidies or information programs or changing social norms, right? We try to understand what worked, what doesn't work, okay? And why do we need to understand it? Because if it's an information failure, providing subsidies would be a big waste of money, right? But if it's really about ability to pay, then running information programs would be a big waste of money, okay? So let me give you 6 lessons that we've learned, okay? So number 1, price is often a very important barrier for poor people, right? When there's upfront costs and the benefits accrue later, maybe you need to provide some credit or subsidies. Number 2, information can be a barrier. And here, His Excellency Mr. Jamaluddin spoke eloquently about trust and clear communication, right? So it's not about information about the existence of a new technology. It's that people have to be persuaded to change behavior, right? And when you need that persuasion, then who delivers that information matters, right? And it turns out, here's some surprising results. So a randomized controlled trial on agricultural technologies in Malawi that I've been doing. So it turns out in that case, you don't need the information from experts or even government extension agents. You need it from other poor farmers who have the same constraints you do. Even if you get it from lead farmers, it doesn't work as well, right? You need it from people who are facing the same constraints you are. Number 3, right? Beyond information and prices, risk aversion often plays a role, right? So you have you're down to your last $50, okay? And somebody's coming and saying, spend it on this technology, right? Let's say it's a stove because of respiratory infections, right? But then you might worry, what if my husband doesn't like the taste of the food, right? And it would be a waste, right? And you and I can experiment with $50, but very poor people can't, because in economic parlance, their utility functions are very steep, okay? Okay, so number 4, we need to understand who within the household makes decisions, okay? So for a stove, it turns out a woman is typically bearing the burden of the indoor air pollution exposure because she's the one who is cooking, right? And when we observe the household not adopting a stove that's relatively cheap, that looks like a puzzle, but not when we think about who the financial decision maker is, right? For the man, it may not be a salient problem. So then we need to design our marketing to understand how do we address the interests of the man, right? Number 5, social norms, as many of my co-panelists have said, are an important driver of behavior, okay? So think about open defecation. If you put me in rural India, it's no shame for me to go out in the open because everybody else around me is doing it. Then you put the same person, my same preferences and constraints, you bring me to Geneva, I'm not gonna do it because you guys might complain, right? And I might not get invited back, right? And I'm not changing anything about myself, right? So norms drive behavior, and if that's true, then we might want to think about how to address norms. Maybe we want to use social network-based strategies, who are important nodes and networks who can be influential to others, because by changing the behavior of some, we'll have a big behavior change. And number 6, the very last one, is that you have to think carefully about how people are currently solving the problem, what the traditional solutions are, right? So, for example, when I said earlier that people have huge variability in livelihoods due to rainfall, but they're not insured. Now, that cannot literally be true. I slipped something past you, right? Because if there are droughts and you're not insured, then you die, right? So what is it that they have? They have informal risk sharing, informal insurance. I help you out in 1 year with the understanding in a future year, if I'm doing poorly, then Chika will help me out, okay? Because we're all born in the same caste, same jati, and that's how we organize ourselves, right? So now, if I bring in an insurance contract, and I tell Chika, please buy this insurance contract, she'll be like, no, but I'm already paying for insurance because Mushfiq keeps asking me for help, right? So even if you offer me an actually fair contract, that's not really a fair price for me, right? So we need to understand how those two things will interact with each other.
Very interesting. Thank you so much. Yes. You said that it's good to get the message from someone who's in a similar condition as you are. I've never heard that before. Thank you for that insight. How did that work for Bangladesh in the context of the pandemic?
Yeah, so in Bangladesh, during the pandemic, okay, I'll tell you the story. Okay, now I will have to talk to the pandemic because you asked me about the pandemic. Okay, so sometimes, things work out surprisingly well. So we conducted a randomized control trial, actually thanks to Dr. Swaminathan for unlocking some of the, by expressing the need for that trial, unlocking some of the funding for it. And so what we did was we tried 20 different strategies to get people to wear masks, right? So it was a 20-arm randomized control trial. We found 4 things that if done together works well, right? And then we scaled it up, okay? So now I think the interesting thing to talk about here is that scaling process and the complexity. So in this particular case, it's actually I'll start with a selected sample. It's a good news story, right? We did the trial. We figured out, okay, here's some things you can do that you can cheaply get people to wear masks, and they stick with the behavior, right? And then we also take blood samples, and we show that this reduces COVID transmission in those communities, okay? So then the question is, okay, we did the trial at large scale with 350,000 people, right? But that's not Bangladesh. Bangladesh is 160 million, right? So how do we go in the next 3 months to scale this up, right? So of course, it needs to move and we scaled up in India, Bangladesh, Pakistan, Nepal, and we learned that in India, if you want to reach millions, that path must run through state governments, right? In Bangladesh, we learned that an organization like BRAC, which almost operates like a parallel government, probably should not say that on camera, they are quite capable of doing it. And the implementation capacity really does matter, right? And there's one final thing I'll say about the path to scale. So sometimes we think about scale as, oh, take research, put that in the government system or NGO system, let it work, right? But also having events like this and changing minds, right? Changing approaches matters. So in the case of vaccines, we've been seeing vaccination rates lagging still in Africa. Why is that? 3 reasons people give. One, we've effectively withheld vaccines from African countries by prioritizing rich nations, right? Number 2, then the rich nations say, no, actually that's not it. If you were to send doses there, they get wasted because hesitancy is so high. Turns out that's not true. Hesitancy in every African country we studied is lower than it is in the United States, okay? Number 3, why does it look like hesitancy? Is because people don't have access, okay? So we collected nationally representative data in Sierra Leone. It takes 3.5 hours each way to get to the nearest vaccination clinic for the average person. It takes 2 weeks of your wages to do it. People are not vaccine hesitant, but they're not that vaccine eager. Under those conditions, you and I wouldn't be getting vaccinated, right? So you need to just solve that access problem. So in that case, we've just run a trial where we do the last mile delivery. We take vaccines on the back of motorbikes along with nurses. We go to the remote villages, and in 48 hours, you get the vaccination rate to move from 5% to 36%, okay? Now, why is that relevant? Okay, so one path to scale is, let's do it all over Sierra Leone. But the different path to scale is, let's stop this BS, and here I don't mean behavioral science, about vaccination, people being vaccine hesitant, right? Let's just show that it can be done cost effectively and have the world change its behavior with respect to how fast doses are sent to African countries.